MT metatarsal bone. MTBI mild traumatic brain injury. MTP metatarsophalangeal joint. MTX methotrexate. MVA motor vehicle accident. MVC motor vehicle crash. MVP mitral valve prolapse. MVPS mitral valve prolapse syndrome. MVR mitral valve replacement. Na sodium. NABS normoactive bowel sounds. NAD no abnormality detected. No apparent distress. NAS no added salt. NB newborn. Note well. NBN newborn nursery. NBTE non-bacterial thrombotic endocarditis. NC nerve action potential. Nasal cannula. NCC non-compaction cardiomyopathy. NCS nerve conduction study. NCT nerve conduction test. NCV nerve conduction velocity. ND, examination, not done. NE norepinephrine. NE neutrophil granulocytes. NEC not elsewhere classified. NEG negative. Neoneoplasm. NES not elsewhere specified. NFR not for resuscitation. NGT nasogastric tube. NGU non-gonococcal urethritis. NHL non-Hodgkin lymphoma. NICU neonatal intensive care unit. NIDDM non-insulin dependent diabetes mellitus. NK natural killer cells. NKA no known allergies. NKDA no known drug allergies. NL normal. NLP no light perception. NM nuclear medicine. NMR nuclear magnetic resonance. NNH number needed to harm. NNT number needed to treat. No nitric oxide. No. Number. NOF neck of femur. Non-rep. Do not repeat. NOS nitric oxide synthase. Not otherwise specified. NPH normal pressure hydrocephalus. NPL neoplasm. NPO nil per OS, nothing by mouth. NPTEC no previous tracing available for comparison. NRB non-rebreather mask. NRBC nucleated red blood cells. NREM non-rapid eye movement. NS. Not significant. NS normal saline. NSA no significant abnormality. NSAID non-steroidal anti-inflammatory drug. NSCC non-squamous cell carcinoma. NSCLC non-small cell lung cancer. NSD normal spontaneous delivery. NSE neurospecific enolase. NSR normal sinus rhythm. NST non-stress test. NSTEMI non-ST elevation myocardial infarction. NSU non-specific urethritis. NT not tested. NTG nitroglycerin. NTT nasotracheal tube. NNV nausea and vomiting. NVD normal vaginal delivery. NVDC nausea, vomiting, diarrhea, and constipation. O nothing. O2 oxygen. OA osteoarthritis. OBGYN obstetrics and gynecology. OBL oblique. OBS organic brain syndrome. OCC occasional. OCD obsessive compulsive disorder. OCG oral cholecystogram. OCNA old chart not available. OCP oral contraceptive pill. Optical coherence tomography. OD overdose. Occupational disease. OE otitis externa. O/E on examination. OGTT oral glucose tolerance test. Oral hairy leukoplakia. Ointment. OM otitis media. Otitis media with effusion. OOB out of bed. OP outpatient department. ONP ova and parasites. OPD outpatient department. OPPT oriented to person, place and time. OPV outpatient visit. Or operating room. ORIF open reduction internal fixation. ORSA oxacillin resistant Staphylococcus aureus. Oral rehydration therapy. OS orthopedic surgery. OSA obstructive sleep apnea. OSH outside hospital. Osmolarity. Osteomyelitis. OT occupational therapy. ODC over the counter. OTD out the door, discharged. OTPP oriented to time, place and person. OV office visit. Ounce. P parturition. Phosphorus. Pulse. Post. Posterior anterior. Postero-anterior. Pulmonary artery. Physician assistant. PNA percussion and auscultation. PAC, premature atrial contraction. Pulmonary artery catheter. Pulmonary artery catheterization. PID peripheral artery disease. PAF platelet activating factor. Paroxysmal atrial fibrillation. Pulmonary arterial hypertension. Phenylalanine hydroxylase. PI1 plasminogen activator inhibitor 1. PAL posterior axillary line. PALS pediatric advanced life support. PAN polyarteritis nodosa. PAO peak acid output. PAOD peripheral artery occlusive disease. PAP Papanicolaou stain. Positive airway pressure. Pulmonary artery pressure. PAP Papanicolaou test, PAP smear. PARAD 2 indicating a woman with 2 children. PAT paroxysmal atrial tachycardia. PBF peripheral blood film. PCA patient-controlled analgesia. PCA prostate cancer. PCD postconcussional disorder. Primary ciliary dyskinesia. PCI percutaneous coronary intervention. PCL posterior cruciate ligament. PCN penicillin. PCNSL primary CNS lymphoma. PCOS polycystic ovarian syndrome. PCP pneumocystis carinii pneumonia. Primary care physician. Primary care provider. PCR patient care report. Polymerase chain reaction. PCS post-concussion syndrome. PCV Packed cell volume. Polycythemia vera. PCWP pulmonary capillary wedge pressure. PD, Parkinson's disease. Peritoneal dialysis. Physical diagnosis. PDA, patent ductus arteriosus. Posterior descending artery. PDE phosphodiesterase. PDGF platelet-derived growth factor. PDR Physician's Desk Reference. PDT Photodynamic Therapy. PE, Pulmonary Embolism. Physical Examination. Preeclampsia. P pulseless electrical activity. PEEP positive end expiratory pressure. PEF peak expiratory flow. PEFR peak expiratory flow rate. PEG percutaneous endoscopic gastrostomy. Penicillin. PEP post-exposure prophylaxis. Pearl pupils equal, round, reactive to light. Perla pupils equal and reactive to light and accommodation. Perla pupils equal, round, reactive to light and accommodation. Pervag pervaginum. PET positron emission tomography. PFO patent foramen ovale. PFT pulmonary function test. PGCS pediatric Glasgow coma scale. PH pulmonary hypertension. PHX past history. PHTLS pre-hospital trauma life support. PI present illness. PIC peripherally inserted central catheter. PID pelvic inflammatory disease. Prolapsed intervertebral disc. PIH pregnancy induced hypertension. PIP proximal interphalangeal joint. PKA protein kinase. PKD polycystic kidney disease. PKU phenylketonuria. Plat tissue plasminogen activator. PLIF posterior lumbar interbody fusion. PLT platelets. PM post-meridiem. In the afternoon. PMB postmenopausal bleeding. PMH past medical history. Perimesencephalic subarachnoid hemorrhage. PMI point of maximal impulse or apical beat. Point of maximal intensity.